Well, we know that mental health conditions impact kids and adults alike right here in the tri-state.
Absolutely. And making sure that everyone has access to resources is CHNK Behavioral Health's mission as an organization.
Yeah, this Mental Health Awareness Month, we're taking time to highlight the group's services and how they're closing the gap for those in need.
My name is Rick Worth, and I have the pleasure of serving as Chief Executive Officer here at CHNK Behavioral Health. Children's Home of Northern Kentucky started in the 1880s, and so we have been around as part of the fabric of Northern Kentucky and Greater Cincinnati for well over a century. We started off as a classic orphanage. Most folks are probably familiar with our founder, Amos Shinkle, who was probably best known as an abolitionist during the Civil War, but he also financed the Roebling Suspension Bridge. And we are still in the business of building bridges to better futures. Children's Home of Northern Kentucky, CHNK Behavioral Health, offers a type of service, a type of residential care for kids known as PRTF, Psychiatric Residential Treatment Facility Care. We serve both boys and girls. There may be folks out there today who think, I can help an organization who's doing that kind of work. We're always looking for subject matter experts, for board members. There were already problems with the lack of providers in the mental health arena in Kentucky and Greater Cincinnati prior to the pandemic. The pandemic certainly exacerbated that problem. And we're still not finished with it. I mean, there is a tsunami of need still heading in our direction. In the United States, there is approximately 350 Americans to every one mental health care professional. If you come to Kentucky, there are counties within a very short driving distance of where we are right now, where that number goes to 4,000 Kentuckians to every one mental health care professional. And so there is a crisis still in terms of a lack of access to the individuals that can actually help families and children navigate this mental health crisis. We are committed to bringing state-of-the-art healthcare services, especially to populations that are suffering the most in terms of access. 90% of our revenues here at CHNK Behavioral Health are tied to Kentucky Medicaid. Folks who are on Medicaid cards and use Medicaid cards to access healthcare services can have so many more barriers than their peers in the general population. And so we want to make sure we have an army of supporters, an army of allies who make sure that we are empowered to provide those services when and where they're needed to everyone. We noticed a few trends in Kentucky and Greater Cincinnati. We noticed a drop in child abuse and child neglect reporting. That certainly didn't mean that child abuse and child neglect stopped or diminished. It was simply the reporting was diminished. And so it is with mental health as well. Our faculty members, our teachers, our guidance counselors, our principals, so many times these professionals are the first to notice that we might have an issue. Major emphasis on school-based mental health care services. How do we get our employees at the front lines of where so many times mental health needs are becoming apparent? That's our schools. Another example of moving services upstream when and where they're needed would be telehealth. And there has been an incredible movement on that in the field of mental health and wellness. If you look here at CHNK Behavioral Health, before the pandemic, 0 telehealth services. Now this organization is approaching 12,000 telehealth services offered since the beginning of the pandemic. With our younger generations coming up, I think there's less of a stigma associated with talking about mental health. I know I'm going to be 57 here in June, and I think if you look at people my age, I think it's probably fair to say we were taught to keep things on the down low when it comes to mental health issues. There were certain things that families simply did not talk about. I don't think there's the same sense of shame and secrecy, and so this whole notion about wellness and health, including mental health, is something to be talked about and something that frankly should be talked about more. You don't have to be a social worker to do something about the mental health crisis that's unfolding in this world. What we say here is that we believe that the bad things that happen in this world will not have the last word. One thing that we can do during the month of May, which is Mental Health Awareness Month, let's get more active in checking in on those folks that we think need a little helping hand. We do something called a community meeting. There's 3 questions. What's the feeling that you're experiencing right now? Do you have a goal for today? Who's there to help you? For folks who want to learn more, check us out at chnk.org, and we'll be glad to follow up with anyone who has an interest.